So thank you very much, Andy. And I'm from the World Bank, but I'm also invited, I think, because I'm the editor of the volume on child development, which is now part of the third edition of Disease Control Priorities. Maureen Durkin referred to the second edition, and in the third edition it's actually a whole volume to itself, so I hope many of you are contributing to that. Zolfi reminded us that we want to discuss today some real-world issues. We want to look at these as real-world issues. What do we need to do differently in the real world? What are the priorities? What in practice should governments and others be doing? And I've been given a short list of selected topics to address by the organisers, and I'm going to go through those. And you know, one of the situations one always finds oneself in is that with a group of specialists like this, I'm undoubtedly going to be accused of being superficial in the treatment of those, but I've no doubt you will have no hesitation to accuse me of that. So I'll move forward on that. Can I have the next slide, please? No, it's me that does it, right? Got it. So the four topics that I want to look at, one is that this is a focus on child development. It's not on child health or child survival or any of those narrow definitions, and it's very specifically on the 0 to 8 years of age, and one asks why those years. To talk about integration among sectors, and I've just listed a few there. Do we really understand how those intersectoral connections work? To talk about caregivers in terms of this idea of a multi-generational influence, that raising children requires more than a single input. And finally, to reflect on the issue of disability, which Maureen so well covered earlier on. So in terms of thinking about the issues of mortality, of development, the mortality data, I think, are one of the great success stories of recent years in terms of health, showing the trends moving down, although not successful enough to have met the MDG goals. And the little yellow bar shows the MDG targets, but nevertheless, some real positive movement in many regions of the world. But if we look at this as in geographical terms, we can see that the problems are very much concentrated geographically, and that we need to be very aware of that in thinking about what actions we need to be taking going forward. Nevertheless, one of the implications of this move away from these achievements in reducing mortality is that we should start to be thinking not only about survival, but also about development. So what are the issues we want to look at here in terms of thinking about development and age? One is the issue of age-specific intervention. There was quite a discussion of that in the earlier presentations. What are the development stages at which intervention should be happening? And also, what are the delivery platforms that are relevant to different ages? Is early intervention always better than later intervention? And related to that, what is irreversible? And I thought the discussion about that was actually very interesting, that there's is no change possible? Is that what irreversible means? That no changes, no benefits are possible later on, or that some change, but that it has some consequences? And the issue of self-agency in terms of later change. The definition or rather the statement that vulnerability outweighs plasticity, which was also usefully mentioned, is also related to this concept of the second chance. There's quite a lot of literature about a second chance, as though children always get the first chance. And I think that this is part of the thinking that also goes into a phrase like vulnerability outweighs plasticity, that plasticity may be indeed, for many children, certainly for the poorest children, what actually gives the opportunity for them to develop self-agency and to develop in life. We had a meeting recently in Palm Springs to bring together the folks from a wide range of development areas. And what we have here is an attempt to sort of summarize some of the thinking that came from that. So this is thinking about an age trajectory, and we've already seen those this morning. So 0 through to 8 would be there, and then on through adolescence. But of course we have the in utero development, and then we have the preconception issues around development. And then we ask questions about what are the impacts of development at different points. And what I wanted to emphasize here was the importance of realizing that there are stages that are specific in development. That development isn't necessarily a continuous process. And as we saw in thinking about the brain, there are lots of processes going on early, and then there are other processes that continue on throughout life, and that changes here also are influenced, also need to be maintained in terms of intervention in later years. In this area in particular, just to stay within the 8 to 0 range that we're focusing on, the Young Lives study showing that interventions in this range in terms of nutrition seem to have a bigger impact on cognition than interventions earlier on. I'm just raising that as a point that stage specificity is going to be part of any of the thinking. This is going to be true in physical growth, where we tend to think about early intervention being critically important. But of course, we've got this area of adolescent growth spurt, which is itself age labile, depending on nutrition and other matters, that also affects that. And even as we've begun to do analysis on mortality across young people, clearly there's this very rapid decline today in mortality in the young years, but we're just finding far more mortality than had been predicted when we start looking across the youth ages. Finally, if we look at emotional development as distinct from cognitive development, yet again there are real stage specificities, and intervening here isn't going to have consequences for those changes and those stages later on. So it's simply making the point that's very helpfully been made by the panel before me, that that 0 to 8 is one definition of where we want to look, but if we want to understand child development, we may want to look more broadly. And if I also relate that to the issue of platforms, if we think of school-age children, that's a group that extends down into the last 3 years of the 0 to 8 range at least. And we may be thinking in terms of preschool actions, early child development actions, and school actions. And in other words, this would also add to the complexity of our thinking about where we should be intervening. I'll move on from that to now thinking about these sectoral issues. And here I want to focus on really three issues. The first is the Flynn Effect and the connection between education and neurocognitive development. The second is, I'm going to take just one particular case, which is school feeding, an example of an intervention, one of the many interventions that we tend to ignore in our thinking about child development. And thirdly, to think about the interaction between health and education. The Flynn Effect is something that many of you will be very familiar with. This is or maybe you're all most familiar with the idea that people have all got taller. Those of you who teach know that your students have all got taller as you... I'm looking to see somebody nod, but maybe that's not... well, the Flynn Effect is that they've also got smarter. So this is standardizing IQs and then looking back through time for IQ tests. I'm just showing what are some of the clearest data. These are all for northern countries, and I'm sure Robert will have something to say about that. But in fact, there are data that show similar drifting upwards in IQ tests globally. These I just chose because this was the original data sets that were presented on this basis. And what the implication of this is that we're seeing something like a 15 IQ point increase per generation in the world. Of course, we don't know how far back that goes because we don't have tests that go back that far. And the question is about that is, what does that mean? Does that really mean that people are getting smarter? It certainly does if we believe in the tests. And interestingly, the tests that show this are the ones which are least context specific. What is the current thinking about some of the implications for that? Well, I want to link this with the relationship between education and neurocognitive development. That a few years of learning, a few years of basic literacy teaching or numeracy causes schooled individuals to think and reason differently. That schooling itself actually enhances fluid intelligence, and where tests have been done comparing those with and without schooling, the level of change is about the same change as is seen in the Flynn effect. And finally now, that there's clear evidence of neurocognitive change in people who have been educated versus those who haven't had those opportunity. And that this links to the idea that education itself may be much more than just providing knowledge. It may also change the way in which our neural architecture functions. Do we think about education and thinking in that way? Not at the moment. Then I want to, again, thinking about links across sectors. I want to mention school feeding. The World Bank, in 2008, when we launched a crisis response fund in response to the financial crisis, we were very surprised that countries were asking for funding for school feeding. This was something the bank had not supported. In fact, the bank was quite outspoken against. In the analysis since then, we discover that the scale of school feeding is remarkable. That there's hardly a country in the world that isn't doing this, that something like 368 million children are fed every day, and that it's big business, $50 to $75 billion of business. And why am I mentioning this? Well, now that the financial crisis is also affecting rich countries, we discover that rich countries are doing more school feeding, and they're doing it precisely in the 5 to 8 year old age group, in the early preschool age groups. And why are they doing it? They're doing it both as a social safety net and also to support education. And by and large, they're not doing it to support nutrition. So I'm mentioning this because, again, here's a platform that's out there that by and large is not present if we look at the debate on child development, on how we address issues of development in poor children. This is yet another area that we tend to overlook. And then finally, I want to just share with you a piece of one of the studies that's ongoing in the volume on child development, and this is looking at the relationship between education outcomes, so specifically education outcomes, and interventions which are either health or nutrition interventions or interventions that are related to education. And the size of the bubble relates to the scale of the effects that are being reported for these. And looking at access to schooling, cognitive development and learning outcomes, we can see that the size of the bubbles for health and for education are often remarkably similar, that when we think about education, we should also be thinking about health and nutrition interventions. Then on to the issue of multi-generational support for development. Who gives care? Who are the caregivers in this environment? And we've listed a few here. The obvious ones we think of, if we think about early child development, are the caregivers in the pre-primary school environment, the teachers, the nurses, and then there are, of course, the groups we've already heard about this morning. I put adolescent girls because there's no question about the gender dimension of this, although, as we saw, boys can also play a role, peers and siblings. And then mothers and fathers, and of course we should have grandparents as key players in all of this. But if we actually look at the numbers involved, we see a very different picture from the one we often reflect on. We see that in comparison to the hundreds of millions of children we're talking about, the numbers of as it were, trained personnel involved in this are very relatively small, and it is these groups which are the main caregivers in practice. And I'm using women of childbearing age as a proxy for mothers, because it turns out that there's not a literature on mothers any more than there's a literature on fathers or on grandparents. Again, we really don't know very much about who is giving care. We don't really understand how that's working. And if I take a more structured view and just compare preschool teachers with primary school teachers, we can see that over the last 20 years, there's really been no, despite encouraging preschool teaching, there's really been relatively no change in relative numbers. Finally, I'm going to just finish with talking about the issue of disability and development. I think Maureen really did a brilliant job on that. I just want to make the point here to set this in terms of thinking going forward, that disability isn't only biological nor social, but some combination of those. And this is the issue of impairment, limitation, and restriction, which Maureen covered. But I also want to make the clear point that there's a big separation between what we think of as physical disability and cognitive and behavioral disability. And that if we look at a hierarchy of actual intervention, we would say that those interventions were being addressed, or those conditions were being addressed in that inverse order, with the physical area being given far more prominence than the socio-communicative area. And that if we then look at some numbers in the real world about disability, these are just to show a range of percentages of the global burden of disability, showing how poorly we understand that, how those numbers, remember this is 1% in global terms is a massive difference. We really don't understand the scale of the challenge, and yet the challenge we know is clearly large. So to finish, the points I wanted to leave you with were that we have a number of new trends looking forward. First, that the focus is shifting from survival to development, and that development needs to be both, those interventions for that development need to be both age and stage specific in the way in which we think about them. And I think the discussion this morning helped highlight that. That there's a whole area of multi-sectoral intervention that we really don't understand very well, and yet clearly is massively important. And then on the issue of caregivers, again, this is an area where we have no useful or very few useful data, and clearly, and yet an area of huge importance. And I would say the same thing for rethinking disability. And then just to finish on a personal note, I want to agree with what was said about human rights being implicit in all of this. Human rights clearly are central to all of this, but also from a World Bank point of view, there's clearly pragmatic and cost-effective reasons for acting in all of these areas. Thank you very much.
Thank you very much, Don. Our next speaker is Parfait Yolande Inyegu from Cornell University. Sorry if I messed up that name.